Carthage Central will provide counseling for students after the death of the freshman student there, Derek Holton. And here to tell us what the counseling entails and why it's important to do this sort of stuff and what you can look for in your own children if they are having difficulties after this sudden death. We have Dr. Fahd Rawra here, a local doctor, to give us the details. So good morning. We appreciate
thank you
your time.
very much for coming in.
How does a sudden death like this affect an adolescent? And does it affect an adolescent differently than an adult?
Well, generally, losing somebody is difficult, but it's even harder when it's somebody young, because you don't expect young people to pass on.
Right.
And when it's abruptly or suddenly versus secondary to a disease. People affected in very severe cases might end up going into full-out depression, and that can be difficult to manage. What we like to do is counsel them and feel like it's a very important tool to help them grieve appropriately.
Mm-hmm. Who should obtain counseling? It may not just be the people that knew Derek, right?
Yeah. Well, anyone who's affected, not just people who are in the immediate vicinity of the person when they passed away, or that were close to them. Sometimes people in the background, people you wouldn't expect, they might also be suffering, because everybody internalizes loss in a different way. So it's important to be mindful of that.
The school is providing counseling for Carthage on Monday.
Okay.
But there are people who may not even really, it may not hit them until they realize he's not in school. How can they get counseling on their own for, you have some numbers that...
Sure. So there's a couple of numbers that I do have. One is the National Suicide Hotline, Suicide Prevention Hotline, and it's, I don't want it to be misleading. But it deals with other crises. Yes, right? It deals with all sorts of crises, so you can always call that number up. May I say?
Yes.
It's 1-800-273-TALK, and there's something called the Trevor Project, and the number for that is 1-866-488-7386. And the mobile crisis service is 782-2327.
And we'll have these on our website, later today.
Okay. And really, that's a chance that if someone wants to just talk, that's someone on the other end of the line in which they can help them with that. In this situation, a parent may say, well, I'll watch my child, and I'll look for the different symptoms, and I'll talk to my child, and I'll be there for my child. When counseling is provided, does the child perhaps tell the counselor different things than what they would tell their parents? So is it different? Is there a different depthness perhaps to the point of having a counselor talk to the child instead of just the parent?
Well, the counselors are trained to offer the counseling more appropriately, but obviously you can't overcome or go around or supersede the parents. Or your relationship with parents.
Right?
Yes, yes. It also depends on how your relationship with your children is and when they're ready to talk. So there is some advice for parents. Be there for your children. Be available. Ask them if they need help. There's nothing wrong with that,
right.
But don't pressure them into it. A lot of times parents will get more excited and may want to pressure. Let the child speak when they're ready to.
And in fairness, people do grieve differently.
Yes.
So.
Yes, and like you had mentioned, the delayed grief reaction, that's actually a very well-known thing to us. Sometimes people it won't actually hit them for up to a year. And we have to be mindful of anniversaries.
Right.
They may initially grieve, and 2, 3, 4 months later, they might be doing better.
There's a lot of first times they have to get through.
Yes.
So as a parent, what should they look for in their children over the next few weeks with differences in maybe behaviors, right?
Okay. If the child is pulling away from everybody, spending more time in their room, not really getting out, stop going out with their friends, that would be kind of a red flag. Again, be there for them, don't push them. Be mindful that a lot of times this brings out abuse, drug abuse. So either alcohol, using a lot of alcohol, using a lot of drugs, that can also happen with the children. So just be mindful of that. Yeah, just be around.
Right.
Do the best you can and try to get them the help that they need if they require it.
All right, Dr. Rawra, thank you very much. Such a sad and tragic situation, and a lot of people are going to be, dealing with aftermath. So it's good to talk about it, and the counseling is there, and I thought it was important to talk about why that is important to have for students. So thanks. We appreciate your time.
Thank you.
We're back here in a couple of moments. Your forecast coming up next.